Hey guys, it's me, Professor D, and welcome to my channel. On this video, I'm going to be covering nursing assessment. Please, if you haven't done so already, be sure to press that like and subscribe button below. That's what's going to keep the videos and the content coming. So let's just jump into it. The very first question. The nurse begins assessment of a client that has come to the emergency department experiencing chest pain by asking the client about 1, a family history of heart problems, 2, medications currently being taken at home, 3, questions or concerns about the hospitalization, 4, the onset, severity, and duration of the chest pain, and I'll give you a moment to think about your answer. The correct answer is 4, asking about the onset, severity, and the duration of chest pain. Guys, chest pain is a medical emergency, okay? Remember, chest pain falls under what? Physiologic integrity. If you if you're struggling with priority patients, make sure that you watch my priority video. I go into detail with that. But patient that's having chest pain, okay, that heart, that's affecting their physiological integrity. This is a medical emergency. You need answers about the current problem right now. So you're going to ask, when did this pain started? What's the severity on a scale of 1 to 10, okay? How long have you had this pain? This is not the time to ask them about past medications, about hospitalization. We want to know about what's happening with that patient right now, which is that chest pain, which is the biggest problem, okay? So that's why number 4 is the correct answer. We need to ask about their current medical issue, which is that chest pain. Next question. The client recently became febrile and states he felt hot. The nurse takes the client's temperature and finds it to be 38.2 Celsius. In addition, the pulse rate's 88 beats per minute, blood pressure 168/80. Which of the following is an example of subjective data? 1, pulse rate of 88 beats per minute. 2, blood pressure of 168/80. 3, the statement regarding his feeling hot. Or 4, the supported fact that he became febrile. And the correct answer is 3, the statement regarding his feeling hot. So guys, you have to know the difference between objective and subjective. Subjective data is anything that the patient tells you that they're feeling, okay? If it's subjective, that's what the patient's telling you. So if a patient says, I feel pain, you're not going to document patient feels pain. You're going to document patient states they feel pain, okay? Objective data is something that's measurable, such as a temperature, such as a pulse, such as respiration, something that you can count, something that you can see, something that's measurable. So that's the difference between objective and subjective. Subjective, you can't count. It's not measurable. This is what the patient's stating to you that they feel, okay? But objective is something that you can measure, something that you can see. Next question. The nurse decides to interview the client using open-ended question technique. Which of the following statements reflects this type of questioning? 1, is your pain worse or better than it was an hour ago? 2, do you believe that your nausea is from a new antibiotic? 3, what do you think's been causing your current depression? 4, what have you done to alleviate the side effects from your medications? And I'll give you a moment to think about your answer. And the correct answer is 3. What do you think's been causing your current depression? So guys, when you're asking an open-ended question, that means you're asking a question that requires the patient to not only think about their answer, but their answer is more than a yes or no. Their answer is more than just a couple words. The answer is going to be a couple sentences, right? So if you look at number 1, is your pain worse or better? That's a yes or no question, or they're going to say better or worse, right? That's just one syllable, so that's not really an open-ended question. That's a closed-ended question. 2, do you believe that your nausea is from a new antibiotic? Again, the patient's going to answer yes or no. That's a closed-ended question. 3, what have you done to alleviate side effects from your medication? Guys, the patient will answer this in just a couple words. Patient can say drink more water, or sleep, or eat, right? But open-ended question forces the patient to think about the answer and to give you at least one sentence or a couple sentences. That's your number 3. What do you think has been causing your depression? They have to think about that. And then the patient say, oh, well, you know, I had a family member died, or I just got laid off, or XYZ. Okay, so closed-ended questions are answers that are questions that your response will either be a yes or no, or the response will be very short, 1 or 2 words. Open-ended questions are questions that the response will be at least a sentence. It forces the patient to think about their answer and forces them to open up and talk, okay? So they can't just give you an answer in just a phrase or a yes or no. Next question. The nurse is going to perform the admission history for a newly admitted client on the medical unit. The optimum time for completion of the history is planned for 1, coordination with the physician's visit, 2, the time when the client's family are visiting, 3, immediately before the client's scheduled MRI testing, 4, after the client has become comfortably oriented to the room. And the correct answer is 4, after the client is comfortable and has been oriented. Let me explain to you why the other answers are incorrect. Look at number 1, coordination with the physician's visit. That is not the time to do an assessment or to ask the patient questions, because the doctor's visiting. That's the time that the doctor is going to be asking the patient's questions. The doctor's going to be looking at the patient. You want, when you're doing your assessment on a patient, when you're doing an admission, you want to have adequate time. You don't want to feel rushed. You don't want to be interrupted, okay? And it needs to be a time for you and that patient. 2, time when the client family is visiting. Well, hello, HIPAA, right? First of all, that patient needs privacy, so it needs to be time that the patient is alone, right? Not when the family is visiting. And number 2, that patient wants to visit with their family. They don't want to answer questions from you at the time. And remember, that time of assessment and asking questions during the admission, that needs to be a relaxed atmosphere, okay? 3, immediately before the MRI? Absolutely not. That patient's about to take an MRI. They're going to be nervous. You don't want to be rushed, okay? You don't want to be asking questions immediately before the patient has to go somewhere. So that's wrong. So the correct answer is 4, after the client's been comfortably oriented. They're comfortable, they know where they are, they're oriented. That's a good time that you could sit down one-on-one while that patient has privacy and ask the questions that you need to ask and do your assessment. Next question. After visiting the client, the nurse documents the assessment data. Both objective and subjective information has been obtained during the assessment. Which of the following is classified as objective data? 1, pain in the leg. 2, elevated blood pressure. 3, fear of impending surgery. Or 4, discomfort upon breathing. And the correct answer, guys, is 2, elevated blood pressure. That's the only thing that's measurable that you can see, right? You can measure that blood pressure. Vital signs are objective. They're always objective. But anything that that patient feels, or they're telling you they're feeling, that's going to be subjective. So your pain in the leg, the fear, discomfort, all of those are subjective because you can't measure that. That's just what the patient's telling you. Next question. The primary source of information when completing an assessment of a client that is alert and oriented as he is admitted to the medical center for diagnostic testing is the 1, client, 2, physician, 3, family member, or 4, experienced unit nurse. And I'll give you a moment to think of your answer. And the correct answer, guys, is 1, the client. And you got a hint in that question. They told you that the client was awake, alert, and oriented. If that client is with it, they are the best source of information. Now, it would be different if the question said that the patient was confused, right? If it said the patient was confused, then you can use a family member to elicit information. But this client's not confused. They're awake, alert, oriented. When they're with it, they are going to be the primary source of information, okay? Next question. During an interview, the nurse needs to obtain specific information about the signs and symptoms of the client's health problem. To obtain these data most efficiently, the nurse should use 1. Channeling, 2. Open-ended questions, 3. Closed-ended questions, or 4. Problem-seeking responses. And I'll give you a moment to think of your answer. And the correct answer is 3, closed-ended question. Now I want you to go back to the question and look at what it said. It said specific information. So when you want to know about something specific, you're going to ask a closed-ended question. Did you have breakfast today? Yes or no? Do you feel pain? Yes or no? Are you feeling anxiety about XYZ? Yes or no? You're asking about something specific, so you're going to ask a closed-ended question. Or, where do you feel your pain? And the patient will say the arm, the head, the leg, right? That's when you're going to ask closed-ended questions. But let's say you want to, patient's just admitted and you kind of want to know what brings them in. You can say to the patient, what brings you in today? And then the patient say, oh, I wasn't feeling well and blah, 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 blah. And they'll give you their whole life story, which is your open-ended question. But when you want to know about something specific, a specific sign or symptom that the patient's experiencing, you're going to ask a closed-ended question where that patient's going to answer either yes or no, or they're going to give you an answer that's just one or two words or a phrase, okay? Next question. After visiting with the client, the nurse documents assessment data. Both objective and subjective information has been obtained during the assessment. Which of the following is classified as subjective data? 1. Client appears sleepy. 2. No physical distress is noted. 3. Abdomen soft and non-tender. 4. Patient feels anxious and tense. And I'll give you a moment to think of your answer. And the correct answer is 4. Patient feels anxious and tense. Can you measure anxious and tense? No. The patient has to tell you that they feel anxious and tense. That's why 4 is the correct answer, because patient feeling anxious and tense, that is subjective. You can't measure that. You can't see it. But let's look at our other choices. 1, client appears sleepy. Appearing sleepy, that's something that you're seeing with your eyes. The patient's lying down and they're talking to you, but their eyes keep closing like this. Or they're talking to you and they're rubbing their eyes and closing their eyes. They're appearing sleepy. You can see that. That's objective. 2, no physical distress noted. You're looking at the patient, right? You're not seeing them wince. You're not seeing them groan in pain. You're not seeing them frown. You're not seeing the pulse or the respirations go up. Okay, this is something that you're seeing or not seeing, so that's subjective. 3, the abdomen soft and non-tender. You're palpating that abdomen. You can see that it's soft. You can feel that it's non-tender, okay? So that's objective. But a patient, something they feel, such as being anxious or tense, that's something that's subjective. Next question. An ER nurse is interviewing a client who complains of abdominal pain. Which of the following questions asked by the nurse has priority at this time? 1, can you describe your pain? 2, have you had this problem before? 3, what have you done to ease the pain? 4, when did your abdominal pain begin? And I'll give you a moment to think of your answer. And the correct answer is 4. When did your abdominal pain begin? This patient's coming in with pain. And like I said a couple questions ago, when it comes to pain, what do you want to know? You want to know the onset. You want to know the duration. You want to know the severity. So when did your pain begin? What's that really asking? The onset. Remember, when it comes to pain, you want to know those 3 things: the onset, duration, and intensity. Onset, when did your pain begin? Duration, how long have you been feeling this pain? Intensity or severity, can you rate your pain 1 to 10, 10 being the worst, 1 being the least, okay? Those are 3 very important things that you have to ask about when it comes to pain. Next question. Which of the following statements best reflects the nurse's correct understanding of the importance of selecting the optimum time for interviewing a client newly admitted to the unit? 1, I'm going to do the history before his family leaves so they can help with the admission history questions. 2, you're scheduled for some x-rays, so I'd like to complete the admission history before you have to leave. 3, I have some questions to ask you regarding your admission history. I'll be back once you're settled and comfortable. 4, let me know when the blood lab is finished with the new client so I can complete his admission history interview. And I'll give you a moment to think of your answer. And the correct answer is 3. I have some questions to ask you about your history. I'll be back once you're settled and comfortable. Remember, when you want to do this history, when you want to ask these patients these questions, you don't want to do it in families there. You have to, number 1, give that patient privacy. And number 2, the family's there, the patient wants to visit with the family, not answer your questions. The other choices of 2 and 4 are both rushing the patient. The patient's about to go get a scheduled test. The patient's going to get blood work. No, we don't want to be in a rushed environment. So we're going to wait until the patient's comfortable. The patient has nowhere to go for us to do that assessment and ask the questions that we need to. The next question. A nurse is observed conducting an assessment interview for a newly admitted client. Which of the following would require immediate follow-up by the nurse's mentor? 1, conducting the interview with the client's boyfriend present. 2, stopping the interview to answer a page from the nurse's station. 3, frequently checking the time while waiting for the client to answer. 4, heard asking the client, am I correct? You've rated your pain a 9 out of 10. I'll give you a moment to think of your answer. And the correct answer is 3, frequently checking the time while waiting for the client to answer. What does that convey? That conveys to the client that you're in a rush and you want them to hurry up, okay? So when you do that, the client's giving you an answer and you're doing this. You keep looking at your watch. You're letting the client know that they're not a priority. You have somewhere better to be and they need to hurry up, okay? So that is the one that's going to require for the mentor to step in and say, hey, stop doing that. You've set aside this time for the client and you need to give the client this time. Now, I know as a student, you were tempted to choose number 1, conducting the interview with the client's boyfriend's present. And we always think about HIPAA. We always think about privacy. So as a student, this should have been one of your choices. But when you're narrowing it down to 1 or 3, the reason that the correct answer is 3 is because with 1, the boyfriend's with the boyfriend being present, if 3 was not present, if 3, the nurse keep looking at their watch, 1 would have been the answer because the nurse mentor could come in and say, hey, I noticed there's someone else there. Have you gotten permission, right? But because 3 was there, and 3, remember, when you're doing an admission interview or any interview, it's so important that you have time allocated, that you're not in a rush, you're not going anywhere. Guys, this is a common theme. That's why number 3 takes precedence over number 1, okay? And our last question. The nurse recognizes that a client's hearing deficits impact the development of the nurse-client relationship. Which of the following has the greatest impact on minimizing this obstacle? 1, speaking slowly, clearly, and in a normal tone. 2, using various forms of nonverbal communication. 3, relying heavily on touch to convey caring and interest. Or 4, involving family and discussions concerning meeting clients' needs. And I'll give you a moment to think of your answer. And the correct answer is 2, using various forms of nonverbal communication. Why? This patient has a hearing deficit, right? But they don't have a visual deficit. So with patients who have a hearing deficit, you're going to use different ways to communicate. What are those examples? When you're talking to them in a normal tone, you can use hand gestures so they can understand what you're saying, right? You can use handouts. You can use brochures, right? You can use models or simulation of things that you're doing. You can use videos. So there's all types of nonverbal communication you can use for the patient that has hearing deficit, and that's what you're expected to do. Guys, I hope this video was helpful for you when it comes to assessment. And don't forget, assessment, that A in assessment is the A in ADPI, Assessment, Diagnosis, Planning, Intervention, Evaluation. Please be sure to watch the rest of my videos on ADPI, not just assessment. If this video has been helpful, please guys, do not forget to press that like and subscribe button below. That is how I'm able to keep the videos and the content coming. Thank you for joining, and I hope to see you next time.